This video is the second video in a series of 3 developed by the Arizona Center for Disability Law, ACDL, through a grant from the Arizona Commission for the Deaf and Hard of Hearing, ACDHH. The first video provided basics about the right to effective communication in healthcare settings for people who are deaf and whose first language is American Sign Language. This video addresses questions individuals have when determining whether video remote interpreting or an on-site interpreter is necessary to provide effective communication between the healthcare provider and the patient. The third video outlines the complaint options when a healthcare provider has refused to provide effective communication during a healthcare encounter. These videos are made available by ACDL and its legal staff for educational purposes, to give you general information about the right to effective communication under the Americans with Disability Act, ADA, the Affordable Care Act, ACA, and the Arizonans with Disability Act, AZDA. The information in these videos should not be used as a substitute for competent legal advice from a licensed professional attorney in your state. By viewing these videos, you do not have an attorney-client relationship with ACDL. Neither actor in the video are attorneys. This video will begin with general information about video relay interpretation, or VRI. Then the video will address frequently asked questions about VRI versus on-site interpreting. The video will end with important resources about this topic. Let's begin. Technology has evolved and has had a profound impact for people with disabilities. Technology is improving how people communicate and interact with others. VRI is a part of this technology growth. VRI is a fee-based service that uses video conferencing technology to access an off-site interpreter to provide real-time sign language or oral interpreting services for conversations between hearing people and people who are deaf or have a hearing loss. Before VRI, many healthcare providers had on-site interpreters to communicate important healthcare information. VRI allows healthcare providers to quickly provide effective communication during emergency and urgent care visits, unscheduled healthcare visits, and in rural healthcare facilities, whether there are shortages of interpreters. However, after VRI became available, some healthcare providers use VRI as a one-size-fits-all solution and refuse to offer on-site interpreting under any circumstance, even where it is necessary for effective communication. The ADA, ACA, and AZDA require places of public accommodations like hospitals, doctor's office, counseling center, and therapy services to provide effective communication. Effective communication means communication between patients and companions who are deaf and their healthcare providers that is equally effective as the communication with people without disabilities. Whether VRI or an on-site interpreter is required for effective communication will depend upon the individual's needs of the individual who is deaf and the nature of the healthcare visit. The Department of Justice, which enforces the ADA, states covered healthcare providers and state and local governments must provide people with a vision, hearing, or speech disability with auxiliary aids and services when needed to communicate effectively with people with disabilities. Qualified sign language interpreters are one type of auxiliary aid and services. The ADA defines qualified interpreter to include remote and on-site interpreters. Most healthcare providers should give primary consideration to patients or companions of patients who are deaf when deciding which auxiliary aid and service to provide. We will discuss more about primary consideration later in the video. Now, here are some frequently asked questions about whether VRI is appropriate. I am deaf, and my primary language is ASL. I also have low vision. My doctor's office uses tablets for VRI, and the screen is too small for me to see the interpreter clearly. Can I ask for an in-person interpreter? Yes, if you have low vision and you cannot see the screen, then the healthcare provider is not providing effective communication. You should tell your doctor that you cannot participate in the healthcare visit conversation meaningfully because you are not able to see what the VRI interpreter is signing. The healthcare provider should talk to you about what you need. Hospitals have different and sometimes better technology. So, if you were at the hospital, you can ask hospital staff to connect the VRI machine to a large screen monitor. If the technology is not available, or if you are still unable to view the screen, then you should request an on-site interpreter. Okay, as a person who is deaf and whose primary language is ASL, I believe there may be some types of healthcare visits that would likely not be conducive for achieving effective communication with VRI. Yes, both the National Association of the Deaf, NAD, and the Registry of Interpreters for the Deaf, RID, developed position statements that provide examples of healthcare encounters in which effective communication for people who are deaf and whose primary language is ASL will likely not be achieved through VRI. Here are some examples that NAD and RID. Eye examinations. Some healthcare encounters in mental health settings, such as group therapy. Some occupational and physical therapy sessions. Classes and large group settings, such as birthing classes or consultation with a large medical team. Initial meetings with specialists. highly sensitive meetings with healthcare professionals, such as healthcare visits to inform a patient about a serious or life-threatening diagnosis. Patient transport. When lighting makes it difficult for the interpreter to see the patient. Healthcare providers do not always recognize that people who are deaf and whose first language is ASL may have other disabilities, such as low vision, or conditions that make it difficult to communicate using VRI. Is VRI considered effective if there is another condition or disability that is impacting the ability to communicate? There are conditions or other disabilities that may impact the ability to communicate and will require an on-site interpreter for equal effective communication. Here are some examples for a practice paper from RID of when it may be inappropriate to use VRI. The patient has a cognitive limitation. The patient is heavily medicated or intoxicated. The patient is highly emotional or presents with violent tendencies. The patient has an injury that interferes their ability to view the screen. VRI may not be effective for communication with a young child. If you are having trouble convincing your healthcare provider or hospital to provide an on-site interpreter because VRI will not provide effective communication for a specific type of healthcare visit, or because of a condition that you are experiencing, you may want to share a copy of RID's position statement on VRI healthcare settings and mental health settings available at this link. I do not mind using VRI for most routine healthcare visits, but often there are problems with the provisions of VRI. For example, the staff do not know where it is, or when they find it, they cannot get a connection, or once they get a connection, the images keep freezing. That is not effective communication, is it? Is it a violation of the disability civil rights laws if the problems persist? Yes, it could be a violation of civil rights laws if the problems persist. Let me explain. Under the applicable civil rights laws, people with sensory disabilities have the right to equally effective communication in healthcare settings as people who are not disabled. You should not be denied access or treated differently because of the lack of auxiliary aids and services. Under the ADA and AZDA, The healthcare provider must meet the following basic standards for VRI: a brief connectivity problem or a short delay in locating and setting up the VRI, or an isolated problem with VRI alone may not result in a civil rights violation. Persistent problems during a communication will result in effective communication and lead to civil rights violations. The video interpretation should be connected using a dedicated high-speed, wide bandwidth video that delivers high-quality videos. The connection is to ensure there are no lags or choppy, blurry, or grainy images, or irregular pauses in communication. A screen that is large enough to display the interpreter's face, arms, hands, and fingers, and your face, arms, hands, and fingers regardless of your body position. The system must be clear and audible so that the healthcare provider and the interpreter can hear one another. And the staff should receive adequate training on operating the technology. So, if a problem, such as gaps, occurs during your healthcare visit, allow the healthcare provider to fix the issue. If the problem persists and you are having a hard time understanding and communicating, then request an on-site interpreter. If you are at the doctor's office, you will most likely have to reschedule your appointment. If you're at the hospital with an emergency, then the hospital will need to locate an on-site interpreter immediately. One limitation with the ADA's regulations is that although it offers broad standards about the use of VRI, the ADA regulations do not provide detailed information about how to meet those standards. Recognizing this gap in information, the NAD, the Deaf Seniors of America, DSA, wrote a position statement providing detailed recommendations about how a healthcare provider can meet each of these standards. You may wish to provide them a copy of NAD and DSA's recommendations and ask them to take steps to improve the VRI. You can share NAD's recommendations with your healthcare provider by using the link on the screen. What should I do if the VR interpreter is not accurately interpreting information? You should stop the conversation and let the interpreter and the healthcare provider know immediately. The interpreting agency will need to locate another qualified interpreter, or the healthcare provider will need to explore other alternatives, like getting an on-site interpreter or a certified deaf interpreter. What should I do if the healthcare provider refuses to provide an on-site interpreter when the VRI is producing choppy transmission and the screen freezes? You should explain to your healthcare provider that they have an obligation under federal law to provide effective communication. Be ready to explain why you are not receiving effective communication. For some issues, like when the screen freezes during the communication, allow the provider to fix the issue first. If the problems continue, then explain to the provider that you are not able to understand and communicate and need an on-site interpreter for the healthcare encounter. If that does not work, check out our third video that outlines your options to file a complaint with an agency that enforces these laws or to file a lawsuit. The ADA says that people who are deaf and use ASL may have an on-site interpreter for all healthcare related appointments, right? Not necessarily. The ADA and other federal laws require that healthcare organizations, hospitals, doctor's office, mental health providers, and others provide effective communication when communicating with individuals who are deaf. If effective communication can be achieved through other means, such as VRI, then the healthcare provider has met their obligations under the ADA. I know what is best for me. Shouldn't the healthcare provider respect my request for an on-site interpreter? According to the U.S. Department of Justice, DOJ, that enforces the ADA, when choosing an aid or service, healthcare facilities operated by state and local governments, such as Access or ALTCS providers, must give primary consideration to the choice of aid or service requested by the individual who is deaf. The state or local government must honor the person's choice unless it can demonstrate that another equally effective means of communication is available. Under the ADA, healthcare facilities operated by private entities or nonprofits are encouraged to consult with the person with a disability to discuss what aid or service is appropriate. The goal is to provide an aid or service that will be effective, given the nature of what is being communicated and the person's method of communicating. Section 1557 of the Affordable Care Act provides greater protection and states healthcare facilities that receive federal financial assistance, which is most healthcare facilities, must give primary consideration to the individual with the disability. The law is constantly changing and evolving. At the very least, healthcare providers should listen, consider your request for an on-site interpreter, and give you a reason for denying your request, and instead of providing VRI, if VRI does not provide effective communication for you for that visit, or because of a condition or situation you are not experiencing, then you have the right to file a complaint or a lawsuit about that refusal. Even if VRI works and meets the technical standards for clear transmission, may I insist on an on-site interpreter? It depends on whether you are receiving effective communication through VRI. For example, if you're having problems understanding the VRI interpreter because the screen is too small, the interpreter doesn't understand local dialect, or you can't make out the interpreter's hands, then this may not result in effective communication. These are just examples, and each situation is different. My provider says that they will only provide VRI interpretation and that by doing so, they are complying with the ADA. Is that my only option, and is that correct? That is not correct. There is a misconception in the healthcare industry that providing VRI will satisfy effective communication requirements under the ADA. Regardless of the healthcare visit or individual needs of the patient or companion in need on an interpreter, effective communication should be evaluated on a case-by-case basis because everyone is different and healthcare visits vary. VRI may provide effective communication for some individuals in some healthcare settings, but it may not work for you. If it does not work for you, tell your healthcare provider so they can explore other options. We thank you for your time. As always, you can visit us on the web at www.azdisabilitylaw.org or call our offices at 602-274-6287. If you need legal services related to the denial of effective communication during a healthcare visit, please watch our third video in this series if you feel that your right to effective communication has been violated.